In this segment, we're going to talk about blocked oviducts. This is clinical case number 6 in volume 1 of Clinical Cases in Equine Reproduction, the ebook produced by Colorado State University. In this case, it's a 14-year-old quarter horse mare. She was referred to us for artificial insemination and embryo transfer. The mare had been bred over a total of 6 estrus cycles during the previous 2 breeding seasons without success. It was reported that 2 different stallions were utilized. It was also noted that she had a total of 7 foals previously in her lifetime. The initial examination on ultrasound, she had a 37 millimeter follicle with a little bit of edema in her uterus and no free fluid in the uterine lumen. Culture and cytology were both normal with no significant growth on microbial culture and no inflammation noted on uterine cytology. We did a low volume lavage of her uterus, and there was, again, nothing grew on culture. Cytology was normal, and there was no fungal DNA on PCR examination. We had discussed this case with a referring veterinarian, and it was agreed that there was a possibility that the mare had blocked oviducts, and that's why the mare was referred to the clinic. Now, blocked oviducts are generally a diagnosis of exclusion. In this mare, she had a history of normal fertility up until 2 years ago. More than 1 stallion was utilized. She was bred over multiple breeding cycles. Cultures were negative, cytologies were normal. The mare cycled well, developed follicles. She ovulated on schedule. Semen always looked good. And there was no evidence of persistent mating-induced endometritis. The treatment that was performed was a standing flank laparoscopy, and during that procedure, 1 ml, 0.2 milligrams of PGE2 gel, Prepidil gel, was applied along each oviduct from the infundibulum to the uterotubular junction on each side. Here's a video showing the procedure. We can see labeled the ovary on the left, the oviduct, and the uterus on the lower right. This is a disposable Casu gun for embryo transfer that's been loaded with the gel, the Prepidil gel, being deposited along the oviduct. You'll see it coming out a little better in a moment. All the way again from the infundibulum all the way down to the uterus. This is repeated on both sides. After that procedure, the mare was given prostaglandins. She came into heat. Semen was ordered when there was a large preovulatory follicle. We administered deslorelin once the semen shipment was confirmed, i.e. we had a FedEx tracking number. On arrival, the mare was inseminated, and the mare ovulated that night or the following morning. 8 days post-ovulation, uterine flush was performed, and we recovered a small grade 1 early blastocyst stage embryo. It was 158 microns in diameter, smaller than we had expected for a day 8 flush. That was transferred into the recipient mare, and that mare was later confirmed to be pregnant. Now, we don't really know if the mare's oviduct was blocked or not. We didn't do anything different than what the referring veterinarian had done before, other than the fact that we had treated the oviducts with a Prepidil gel. Again, we don't know, and we'll probably never know, that this mare went home. The mare never came back to our clinic. Another thing we don't know is if this truly was oviductal blockage, would this mare ever get blocked again? There's a lot of questions we don't know. A little review, though, of oviductal blockage. It's certainly been talked about more in the last few years than the previous couple decades. But there have been studies showing that blockages and debris does occur in the equine oviduct. And blockage has been suggested to occur at the junction of the ampulla and isthmus of the oviduct. and the blockage consists of mucus, collagen, degenerated cells. It may prevent sperm, possibly not, in my opinion, but it may prevent embryo transport down the oviduct and preventing entry into the uterus. And it's possible in some of these problem breeder mares where they have infertility of an unknown cause. It may be blocked oviduct. Again, it's a diagnosis of exclusion when you rule everything else out that you can. True diagnosis of blocked oviducts is difficult to confirm. Starch granules have been used, microspheres have been used, but again, even on normal mares, it's not easy to tell if the oviducts are patent or not. Just a brief review of the anatomy of the oviduct in the mare. The infundibulum is up here next to the ovary with its fimbria at the distal end, covering the ovulation fossa. The center part is the ampulla, and then the isthmus down here, leading to the uterus through a very tight uterotubular junction. Here we can see in some histological photographs the infundibulum up here on top and the fimbria part of the end of the infundibulum. The ampulla is in the center. The passageway starts to get narrower and narrower, and the muscular wall gets thicker as you go from the infundibulum to the ampulla, and then finally to the isthmus. Potential therapies for oviductal blockage, including flushing the oviduct from a ventral midline surgical approach, either retrograde from the uterotubular junction or what's been called normograde from the infundibulum distally. As has been described, PGE2 has been deposited onto the oviduct using laparoscopy. Dr. Allen in 2006 and colleagues reported that 14 to 15 mares treated with PGE2 conceived during the same or a subsequent breeding season. Ortiz and colleagues in 2010 noted that 18 of 19 mares became pregnant or donated embryos after that same PGE2 treatment. Other potential therapies, including an oviductal flush, also called hydrotubation, first reported in 2013. And researchers indicated that 11 of 14 mares became pregnant following that procedure, and they had not been pregnant before. And we can see this is done through a video endoscope, and a cannula is actually placed up into the uterotubular junction, and that is flushed retrograde up toward the ovary. And finally, what is more common now is PGE1 misoprostol deposited onto the external part of the uterotubular junction by a deep horn infusion technique. This was first reported in an abstract in 2018. And in that abstract, they reported 13 subfertile mares that had been barren for at least 2 years and over 10 estrus cycles. 200 micrograms of PGE1 was dissolved in 3 mils of sterile water and deposited near the UTJ by a deep horn infusion technique using an insemination pipette. Mares were bred on the next cycle, and embryos recovered or pregnancies obtained from 10 of the 13 mares within the first 2 cycles. A follow-up study using 22 mares treated during diestrus, 68% donated embryos or became pregnant within 2 cycles after treatment. It's an intriguing technique that is easy to do and inexpensive, and may be a way to treat some of these mares with a possible oviductal blockage. The clinical technique, again, is 2 misoprostol tablets are dissolved into some sterile tubes, like a red top tube. 3 mils of sterile saline or sterile water is applied down into the tubes. Allow the tablets to dissolve. One can add a small amount of sterile obstetrical lubricant. We don't do that. The suspension is drawn up into an AI pipette and simply deposited at the tip of each uterine horn at the UTJ using a deep horn infusion technique. The take-home messages for this case: again, oviductal blockage is a diagnosis of exclusion in mares with no other explanation for failure to become pregnant or donate an embryo. Once in a while, you might hear an owner note that this mare only becomes pregnant if she ovulates from the left ovary. And that may be because the right ovary, the oviduct, may be blocked. Hydrotubation, topical application of PGE2, or infusion of PGE1 all have potential as therapies for oviductal blockage. For further information on these cases or other cases, please look at the website for the Equine Reproduction Laboratory at Colorado State University. Thank you.